Good morning, everyone. Welcome to the Mass Vaccination Hub in Homebush. It's really exciting to know that it's up and running already, and I want to thank all the staff in New South Wales Health for making this possible, and all of the health workers and their families who've been so enthusiastic in coming forward to register. As you know, New South Wales already has 5 mass vaccinations hubs in our hospitals, as well as 100 sites across New South Wales, but there's no doubt that this Homebush facility gives us that extra capacity. We envisage when it's fully up and running that we'll be able to do around 30,000 doses every week, and of course we do have capacity, depending on the doses that we receive, to make sure that not only do we reach those targets, but sometimes we might even be able to exceed them. Now, there's 2 exciting bits of information that I want to make sure the community is aware of. Firstly, that if you are over 50, like me, and want to get the AstraZeneca vaccine, you can register from Wednesday your interest, and then obviously we'll be doing the vaccinations from the 24th of May at this Homebush site. However, I do want to stress that in the first instance, anyone over 50 should be contacting their GP. The GPs have been doing an amazing job, as they normally do in New South Wales, in mass vaccination. We've seen thousands and thousands of jabs provided by our GPs every single week, and for us to reach our targets in New South Wales, we need all the GPs at their full capacity, as well as all of the New South Wales health facilities at their full capacity, to make sure we get through as many jabs as possible. So if you're over 50, please contact your GP, because from next Monday you'll be able to get your AstraZeneca vaccine if you're over 50, and then from the New South Wales hub you'll be able to get it from the 24th of May, but you can register from this Wednesday. If you don't have a GP or don't have access to a GP, or you find it difficult getting to your GP, you can book with us from the 12th of May, this Wednesday, and get your jab from the 24th of May. So you'll be told when it's your turn and you'll be able to come and get the jab. Now, excitingly, from 5 o'clock today, we're taking registrations or expressions of interest from anyone from 40 to 50 who'll be eligible for the Pfizer vaccine. So if you're aged between 40 and 50, you're able to register from today through the newsouthwales.gov.au website. That's around 1 million people in New South Wales, so it's a lot of people, and obviously we've worked hard to get our systems up and running to make sure that we use up every dose that we're given. So if we know those who've put their names forward between the ages of 40 to 50, at this stage most of the Pfizer vaccines will be done by New South Wales Health. So we ask everyone who is interested between the ages of 40 and 50, or 40 and 49, to be precise, 40 to 49 is a better way of expressing it. Make sure that you register from 5 o'clock today to get that Pfizer vaccine. And we can't tell you exactly when it will be your turn, because obviously for the initial period of time at this vaccination hub, we're focusing on all those emergency workers, aged care workers and their families, and new quarantine workers that come online and their families to get the jab in the immediate future. But obviously beyond that point, and it could be within weeks, we're envisaging that 40 to 49-year-olds will also be able to get the jab from this mass vaccination hub, and that's really exciting. We're trying to make sure that we get through as many people as possible, because remember, we have an adult population of around 6 million in New South Wales, so even if you vaccinate 5 million people, that's 10 million jabs. We're getting close to 700,000, but obviously we have a way to go. So the more we can do at any point in time, the better it is. And I just want to encourage everyone who's eligible to come forward, so and register their interest. Or if you're over 50, make sure you let us know if you want the jab from this location from the 24th of May. I'll now ask Susan Pearce to say a few words. So New South Wales Health, under Susan's leadership of the rollout of the vaccine, has made sure this centre is up and running in a short period of time, and we're just grateful to everybody for making that happen. And I want to stress that beyond the initial, obviously the vaccine rollout is the federal government's responsibility, and beyond the initial 300,000 people, the states were to down tools, but we're really, really pleased to step up and support those efforts, to support the GP network, to make sure we get through as many vaccinations as possible. I'll now let Susan say a few words, then Dr. Chant will give us a quick update, and then Minister Hazzard will provide some further information as well. Thank you.
Can I start by thanking everybody who's been involved in establishing this centre in such a short period of time. 20 working days is what it's taken to fit this building out. And for those of you who were here just a couple of weeks ago, you would know that there weren't even floor coverings in this building. So the team at Sydney LHD, supported by a lot of partners, every district in New South Wales has really helped us with this, along with other external partners, private health providers such as Ramsay, HealthScope, our university partners. Everyone is here today because of that effort. It's wonderful to see people outside coming to get their jab. We want people to come forward and get their jab. It's really important part of our response to COVID that as many vaccines are given as is possible, which is why we've taken the time to build a centre like this to take the volume that we can take in addition to all of the other centres that we've got open across New South Wales. We look forward to seeing the numbers through here today, the week and the weeks after that, and we've had a strong response to the centre, but from my perspective, it's a big thank you to the people who've delivered this for us and for our state. Thanks.
Thank you, Susan. In terms of the numbers, we will release the official numbers at 11 o'clock as per usual, but I can indicate that there's nothing particularly of concern in those numbers we'll be releasing. In terms of the update on the investigation, can I again extend my appreciation to the particularly the gentleman who was the sort of index case that disclosed this transmission risk in the community, who's been very helpful. There's been a lot of work being done to identify how the transmission event occurred. Unfortunately, we haven't found that missing link. And what's clear is that this gentleman, because we have tested everyone in close proximity to this gentleman in terms of our upstream testing, the contact with the infectious person must have been very fleeting. So because of that, we're still concerned that there may be chains of transmission in the community that are yet unrecognised. What's pleasing is that our sewage surveillance for Marrickville, which was positive earlier last week, a low positive, was negative over the weekend. We're recollecting those samples again today. But unfortunately for us, not unfortunately for nature, there was a lot of rain last week. And the rain actually impacts the reliability of our sewage because it dilutes that testing. So again, these are all of the factors that we pull together to influence our decision making. So we're not out of the risk period. We know that COVID can present as a very mild illness and it can circulate unknowingly in the community. So my plea to the community would be, please come forward and get tested if you have the most minimal of symptoms. Sustaining those high testing rates this week will mean that, one, we could be reassured that we're not missing any chains, that those chains have just burnt out naturally and not sustained. Or if we have missing any of those chains of transmission, that we can find them at the most earliest point in the transmission chain. And it's easier to extinguish those chains of transmission the earlier we find them, before they're distributed more broadly in the community. So can I thank everyone for their cooperation. It's pleasing to see those testing rates up. I'd like to see them a little bit higher and sustained over this coming week. But again, thank you very much to the community for their compliance with the requirements.
Premier, can we?
Oh no, we'll just get Minister Hazard to come.
There you go, Clinton. There you go. Look, can I start by actually thanking the Sydney Local Health District and Therese Anderson, who is the Chief Executive, and her team for actually bringing this together. It was Joe Edwards, who's standing over the back there, who found this property now just a few weeks ago, and I think it was realestate.com or something similar, and it was a bare, empty building. Now it's headquarters for our fight with this virus. Can I say this? It's 15 months since this virus came to our shores here in New South Wales, and it's been a war ever since. We are fighting back, and this is now our headquarters for the New South Wales health team, who are backing in the federal government's GPs. We knew that it was likely that we'd have to step in and assist, and now we're here on the front line with more than 300 of our frontline health troops who are here to help our community fight the virus. I encourage people to listen to the messages. Our residents should listen to the messages from New South Wales Health over the next few weeks and months. Like any war, it isn't going to be won in the next few days. It will be many months before we win. and we need people to back in our frontline health troops. The messages will change. It depends on what's going on with this virus. It also depends on vaccine suppliers. Like any good army at the front, we need the weapons to fight, and that means knowing that we've got a good supply of vaccine. That's obviously been a challenge in the first few months. But hopefully now, with the federal government's new supply lines, we can be assured that we will get that vaccine. But we still need our residents to hear the messages from us, from health, to know when you can come to get your vaccine. For the next couple of weeks, it's Pfizer, and of course then AstraZeneca. But the message is very clear. First and foremost, if you are over 50 and you are having AstraZeneca, you should be going to see your GP. They're the people who know your medical history. They're the people who can chat to you about what effects it may or may not have on you and how it might help you. But if you don't have a GP and you can't find a GP, well, New South Wales Health and our fantastic health team are now here to back in what the GPs may not be able to do if you don't have a GP. Thank you.
Premier, how many people have booked in to get their Pfizer jab at this site today? And do you know how many of those bookings are people that made a booking over the weekend but aren't actually eligible for a Pfizer jab because of the way the online portals work over the weekend?
Right, there's about 5 questions in that. But generally speaking, we've had thousands of people come forward and register for the next month. We're very pleased with those registrations. But what we want to do is make sure that if we have any excess doses, or we suddenly get doses we didn't anticipate, that we're able to draw on 40 to 49-year-olds that can register from today. So, can I just finish my sentence, please? So, for example, if there is any underusage in a week, so for example, if we anticipate there might be certain thousands of people who've registered, but there's a few thousand left, we can then draw upon the people from 40 to 49 who've registered with us from 5 o'clock today and call upon them. The key thing for us is to make sure we use up every dose that's available as soon as we can. And that's what we're trying to do, to make sure that we built the booking systems as we did. And if you've had a chance to look downstairs, you'll see how quite sophisticated the booking system is. I even had the chance to go to the pharmacy and see how they've managed to literally identify each vial, each vaccine, to make sure that not only is everything as safe as possible, that we're able to literally track each vial to make sure we're getting those doses out. So it's really important for us to maximise the use of all of the hubs we have. So the reason why we're very excited about asking people from 40 to 49 who are interested in getting the Pfizer vaccine to show their interest. We can't tell you exactly when you'll be getting the jab, but we'll be able to give you enough notice to get yourself here in the coming weeks to start that. And that's to make sure we use up every single one. And please know that we've been going at this since late February, so a large cohorts of our workers and their families have been vaccinated, but obviously we're keen to finish all those key cohorts and then start on the general public as soon as we've done that.
So, Premier, just to clarify the 40 to 49 age group, because I don't think we've heard that before. You're saying that members of the general public
yes.
could be vaccinated within weeks?
Well, that could start to be vaccinated within weeks. And this is our way of saying to the general public that New South Wales is keen to get as many people vaccinated as possible, because I strongly believe, and our New South Wales team strongly believes, that the more people that are vaccinated not only allows us to have a safer community, but also allows us to think about the future and when we might be able to do things we can't currently do now. And we have a sense of urgency in New South Wales. The more people that are safely vaccinated, the more ability we have to ease restrictions moving forward, and also to resume life as normal as we can with COVID, because we don't know how many years this is going to be around, and the quicker we get our population vaccinated, the better. So that's why today's news is very exciting. If you're in the general public and you're aged between 40 and 49, you can express your interest from 5 o'clock today through newsouthwales.gov.au to say that you're keen to get the Pfizer jab. And I'm extremely grateful also to Service New South Wales, because they've supported health in setting up our booking system, to making sure that people will get those prompts. They'll be advised when they are eligible to come and get the jab through the New South Wales Service New South Wales app. So we're really lucky in that we've got nearly 4 million people, actually nearly 5 million people on the Service New South Wales app, which gives us the ability to communicate with people at short notice and to let them know when they're eligible. So we want to make sure we use up as many doses as we have, and that's why in any given week, if there's less than 30,000 people who've registered in this hub, or less than thousands of people who've registered throughout the state, and we have capacity, we'll be able to draw on those people who've expressed their interest. All we're asking at this stage is some patience, because obviously it's a new system from today. The booking system for Pfizer comes on online from 5 o'clock today. We just ask people for their patience, and you might express your interest today, but it might be some while before you're invited to come and get the jab. So it just depends on the take-up with the frontline workers and their families. And also, of course, don't forget, if you're over 50, from next Monday you'll be able to get the jab from your GP. So please make sure you've already rung your GP to get the jab if you're over 50. And if your GP, if you can't get it through your GP or don't have a GP, please register from Wednesday this week to get it through New South Wales Health.
Dr. John, can I just ask, on ATAGI, does New South Wales Health have any members as part of that?
So ATAGI is a technical advisory group, so it's not a jurisdictional group. There is New South Wales-based experts that sit on ATAGI, and we contribute our experts, but it isn't a jurisdictional committee, hasn't got jurisdictional representative as perhaps the Australian Health Protection Principal Committee is.
What damage has their advice done to the vaccine rollout more broadly as a result of essentially forbidding anyone under the age of 50 getting AstraZeneca?
I think the community should be actually very reassured that we have such a strong regulator in the TGA, and that we are supported by such expert advice, such as ATAGI. And can I just say, those individuals on ATAGI, and I've contacted many of them and spoke to many of them, they're up day and night because 24/7 they're engaged in teleconferences with regulators across the countries to get the best available evidence to inform their technical advice. So for me, I think the community should be really very reassured that we have such a strong regulator in the Therapeutic Goods Administration and such good experts who can guide our decisions around vaccine.
There's significant reluctance around AstraZeneca, 50 or 50 under, 50 over, it doesn't matter. It's almost like a dirty word, getting the AstraZeneca vaccine.
We've had it.
So both the Premier, the Minister and I have had it, and I'll be rocking up for my second dose of the AstraZeneca vaccine. I think I've disclosed my experience with it. I did have a bit of fever, sore arms and felt chills, and I'm putting that down to a robust immune system, because that makes me feel better. I'm not sure the exact correlation. But the point is that we should be guided by expert advice. And I really respect the advice of ATAGI. They are continuing to review the data every day, and they will update the community. So therefore the community should have trust in the actions. Over 50s, they're given advice about the risk-benefit, and clearly the risk-benefit of catching COVID is much more severe than any risks, the rare risks associated with the thrombotic, the special thrombotic syndrome that's been associated with the AstraZeneca. But it is important, and I would expect everyone today who's rolling up, even for the Pfizer vaccine here, that all vaccines have risks and benefits, and that's why we do urge everyone who is getting vaccinated to take that time to read the information sheet, to be aware of the side effects and what to do if those side effects last for longer or are not predicted.
Dr. Chen, just this 40 to 49-year-old making Pfizer available to these people if you've got spare Pfizer. Have we suddenly got more Pfizer, or are you just trying to maximise the usage of the Pfizer that we've already got and just make sure that it goes to everyone in this waiting?
I think clearly we want to use every vaccine dose that we have, and so this is part of our contingency. This is a big logistic exercise. You've seen the throughput, and this is day one. So I expect the flow through and this place to be buzzing at all aspects. So of course we want contingencies, and that's why we've offered those expressions of interest, so that we make sure that we don't waste any doses.
And how many bookings are here today?
I think Susan Pearce would be probably thousands booked in today.
Like 2.5, 3?
Yes.
Yes. Yeah.
Dr. Chen, regarding last week's positive case, the identity of Barbecue Man has been published today. Given that he did everything right in regards to QR codes, reporting where he'd been, is it a little disappointing that could put people off?
I'm incredibly disappointed, and I think I've stood up here every day, and I've got to say I really respect the way the media hasn't pushed me mercilessly when I've said I won't give them the exact age or I won't disclose something. So for me, that was really when I became aware of that late last night, we immediately, one of our senior public health physicians reached out to the gentleman to make it clear that that information in no way came from New South Wales Health, and that was not in accordance with the wishes of the gentleman. And I think that we do need to be very thoughtful. I mean, in the end, we rely on people sharing the most blow-by-blow descriptions. I can't imagine this gentleman has had calls probably 2 or 3 times a day. He's helped us recreate his walking route. He's helped us go through every credit card time stamped. You know, he's really gone above and beyond to help us. And I think that it's not a good outcome from public health when that happens. We obviously take the approach that where we need to, we will be very frank with any information, but that was not necessary.
Dr. Chan,
Sorry?
What's your view on the AFR
I think it's absolutely appalling. No journalist should think that it's okay to go naming a patient, somebody who's working with health. It's the quickest way to destroy the confidence of all of us if we think that some journalist somewhere thinks that it's okay to name a patient who is actually working with us to make sure the community stays safe. It stinks, actually.
Dr. Chan, can I just ask, we're obviously searching for the missing link. Is there any chance, I'm not sure where the specialised health accommodation is and how close they might be in proximity to the venues that this man visited, is there any chance that it could be direct from the returned US traveller during that period when they were transported or potentially even airborne or through an air conditioning system?
So look, we're investigating all lines of inquiry. Obviously the direct route has the most appeal. We've reviewed the CCTV footage. We have recreated the gentleman's walking route to see if there would be any opportunity for crossover. At this stage, we haven't found that. Clearly, this gentleman was in the city area, and some of his walking routes did take him down around the precincts of the quarantine hotel. But we have looked at the vision of when the patient was transported and can't see any way in which the gentleman would have been directly exposed, but our lines of inquiry are continuing, and that's what I'm saying. This gentleman has taken multiple calls as we pursue and get additionally new information to actually figure out how the transmission event.
Has everyone working at the Park Royal and the special health accommodation at the same time as this gentleman, the returned traveller, is there? Has everyone been tested, or are there still some people that haven't been tested after?
Look, the vast majority of people in the investigation have been tested. On the weekend, we've looked at the CCTV footage often on multiple occasions, and on the weekend another team went and looked at it just to see if there was anything missed. Occasionally you find another individual that perhaps there might be some remote possibility. Certainly any direct people that they've been in contact with, we've certainly tested, but we're continuing to look and keep a very open mind to how transmission would occur. So the staff have been tested, and the best available advice is that the vast majority of people in our lines of upstream testing have been tested.
Off the back of that, Mr Hazard, one of the areas of investigation that New South Wales Health was conducting, obviously, that restaurant, the XOPP, which had apparently failed to be properly running its QR code system. What do you say? Can you update us on that, first of all? Do we know any more about how the investigation's going? Are fines likely on that particular institution? And what message would you give to others about QR codes?
Look, I won't comment on individual restaurants and cafes, but what I would say is that we are still in the middle of a pandemic that is wreaking havoc across the world. Businesses across New South Wales really need to take the use of the QR code extremely seriously. Make sure it is in a very prominent place, and make sure that every person who comes through your door is asked and reminded to use the QR code. It's very easy, very easy. I mean, we all have very busy lives, and when we go in for a coffee sometimes or dinner, we might forget to use the QR code, but the business itself has an obligation to make sure that in a nice way they remind people to use that QR code. It's a pretty simple step, isn't it? To hold your phone up, do the QR code. We've got Service New South Wales QR code. It's by far and away the easiest QR code usage capacity in the country. It's basically a 2 to 3 step model. As long as you've got the app on your phone, it's not hard. So certainly to the businesses, I implore them to realise that each and every one of them may have somebody walk through their door that has COVID, and we need to be able to track that fast. Not doing that disempowers the tracers. The people who have actually made sure we are safe are our health staff, and particularly our gold standard, our platinum standard tracers. But they need that information to be able to do it. So for Pete's sake, get out there and make sure that your QR code is smack in the front of your shop or your building, and get it used when anybody walks through the door.
Brenda, can we ask as well, you decided to extend the restrictions another week, so effectively doubling the original 3-4 day proposal you had. Was that really necessary? And secondly, was it a captain's call, or did you involve?
Can I say in the first instance, nothing the New South Wales government does is anything but the best health advice from Dr. Chant, and I'll let Dr. Chant explain why she provided that advice to us, and why in fact we've now supported people who are going shopping not to have to wear masks, but of course the retail workers have to continue to do that for another week. But I'll ask Dr. Chant to provide.
The captain's call thing, was that just your decision? Or did
No,
you
gosh, no. At the end of the day, we're in the middle of a pandemic. I get the best advice from the Chief Medical Officer, from the Health Minister, and we make sure we make the best decisions on behalf of the government for the people of New South Wales. But I will ask Dr. Chant to explain from a medical perspective why she provided that advice and why it's important for us. But I will say this, as Dr. Chant mentioned, our health teams, our health detectives, which I believe are the best in the world, have gone through lots of CCTV footage, spoken to lots of people, and so the concern is that whoever, or if it's one or multiple people, are those missing links. It was a very fleeting meeting or fleeting time that they met with that gentleman who got the virus, and so that suggests there could be a high level of contagion from someone who's passed it on. But I'll let Dr. Chant explain that.
Thank you, Premier. That's exactly the case. I mean, at the moment, we've tested everyone, very close contacts with this gentleman. We haven't found any source. So clearly the encounter must have been a fleeting one. We're still pursuing some additional lines of inquiry for that upstream testing, and but what we're concerned about is that there might be broader transmission in the community and for it not to have been detected. We've seen that, for instance, in the cases of the Avalon, how you can then get some seeding and a super spreading event, which then requires much stronger public health action. So because of that concern, what we've done is just taken a very what I'd call moderate level of safeguards. So indoor mask wearing. The rationale for hospitality workers to be wearing it and not for patrons is because clearly when you're going to those hospitality venues, you're eating and drinking, and it makes no sense to be taking it on and off. But what we've seen in a number of our scenarios is that hospitality workers can often get infected from their patrons, but then because they encounter so many people in a day, they then can spread it. Again, in retail, we've seen actually not many transmissions in retail settings. The exception is when the actual retail worker is actually positive. And again, it reflects the number of people and the number of opportunities that you have for transmission. Again, mask wearing in public transport, we've had good community acceptance of that, and I think the community understands why that's so useful, particularly for us in terms of contact tracing. Even with the support of Transport for New South Wales, which gives us that tap-on, tap-off data, contact tracing for trains is actually really complicated because most people don't actually remember exactly which carriage they were in at which time. There's a lot of crossover on platforms, and so it is actually a complex piece. Even though the community's really helped us with that and we've found some of those connections, it is a challenge. So we've chosen to have mask wearing to take off that risk of a super spreading event, and tried to focus on the most, having the most minimal impact but the greatest outcome. The other restrictions...
I was going to add something.
Yeah. And the other restrictions around high-risk activities are, again, things that we hoped, if the community can bear with us, don't have much impact on how you go about your daily lives, but really stop that super spreading event that we have seen, particularly in those hospitality venues. So this is really around keeping us safe, preventing those super spreading events while we sustain those testing levels at a high enough level so we can be really confident that if there was any transmission in that community, that it has been extinguished. Or if not, we find it very early, because the earlier we find the transmission, with we can then implement more minimal restrictions or minimal, we can get away with contact tracing alone. But it is the unknown factor here that is the critical aspect.
Last question, please.
The 40 to 49 is a bit of a break from the federal government's design plan rollout timeframe. Is this New South Wales government sort of taking over, if you like, responsibility for New South Wales? You'll decide with what vials and what ages?
No, certainly not. What we're doing is preparing ourselves to make sure every single dose we receive, we use, because we've learnt since the vaccine rollout was announced by the federal government that sometimes we get doses we hadn't expected, sometimes we get less or more, and we want to be ready. And we want our population in New South Wales to know that their government, the New South Wales government, is really keen to see as many people vaccinated as possible. I want to be very ambitious in how we can support those efforts, and it's important from day one for us to send a strong message to the community that the sooner the vast majority of us are vaccinated, the sooner we can get to a COVID normal existence. We're not there yet. We don't have a COVID normal existence yet because the vast majority of our population isn't vaccinated. But once the vast majority of our adult population is vaccinated, we can take some more decisions. And I'm quite proud of the way in which obviously the Chief Medical Officer provided advice to us in the way we approach the outbreak in New South Wales. The vast majority of people were not impacted. Yes, it might be inconvenient to have to wear a mask when you don't want to, but if that's the biggest thing that we have to do during an outbreak, that's actually a very good result. What isn't a good result is when you have to shut down businesses, when you tell people they can't leave the house. No, that's not a good result. And we never want to get to that place. And that's why we'd much rather take decisions based on the health advice, which give our citizens maximum freedom, which ensure businesses stay open, which ensure that we are living as close to normal life as much as possible. And from time to time, if some of us are inconvenienced, well, we are in the middle of a pandemic, and that's what we have to accept. But certainly, our plans for New South Wales are ambitious. I was very vocal in suggesting to the federal government that the states step up and help where we can, and I mean that. If we get more doses, we will provide that. But we also have to know that more than any other state, New South Wales has relied on the GP network. They've always been very key to our vaccination program. So if you're over 50 in the first instance, go to your GP, contact your GP. But if that's not possible, or you want to come through our system, you're more than welcome to. Just register your interest from Wednesday and you'll be able to get the jab from Monday the 24th. But also, if you're between 40 and 49, in the general public, and you want to get vaccinated, you can start registering your interest from 5 o'clock today through newsouthwales.gov.au, so that if we do have any weeks where there's less than 30,000 people who've registered, we can call upon that cohort of people to say, come and get your jab. And that is our way of sending a strong message to everybody how important it is for our population to get vaccinated. We want to be able to start thinking about opening borders, about easing restrictions, about getting on with life in a normal way without compromising health. Health is always our number one priority, but so is our state creating and keeping jobs and making sure we're moving forward and making sure we continue to be world leaders in the way in which we've dealt with COVID. Thanks, everyone.
Is it disappointing, Premier, to see Mr Turnbull campaigning for a candidate other than a coalition member in the upper number?
Oh, look, I'm just focusing on Dave Lizelle and what a great candidate he is, and looking forward to getting up there soon again. Thank you.